Hello, everybody. I am Dr. Greg Polin, Professor of Medicine and Infectious Diseases at the Mayo Clinic and the Director and Founder of the Mayo Vaccine Research Group in Rochester, Minnesota. We're going to be talking today about COVID-19 vaccines and the evolving landscape. In particular, we're going to have a discussion today on best practices for implementation and series completion. This is the fourth installment of a six-part series of podcasts that we will do on the COVID-19 vaccine landscape. We're having our discussion today at the end of May 2021, and I'm delighted to be joined by Dr. Lourdes Planas. She's an associate professor at the Department of Clinical and Administrative Sciences at the University of Oklahoma Health Sciences Center, College of Pharmacy. Welcome, Lourdes.
Happy to be here with you today, Dr. Polin.
Well, we're going to try to cover a few things. We're going to look at best practices for implementation and series completion, and we'll try to answer the question, why is series completion for the mRNA two-dose vaccine regimen important? What's the current status of vaccine series completion here in the US? What kind of challenges are we seeing with getting people back for the second dose? And from that kind of derive some best practices. So let me start with asking, from your viewpoint, what is the current status of vaccine series completion in the US?
Well, at present, 130 million persons in the US are fully vaccinated. So they've completed the two-dose series. And consider that in light of the fact that 164 million have received at least one dose. So with these 130 million persons that are fully vaccinated, that represents 39% of the total US population. Now that is an average for the country. Realize that it does range. The lowest range that we have seen is 27% in Mississippi, up to 52% fully vaccinated in the state of Maine. Overall, we see higher percentages on the West Coast, in upper Midwest states, and in the Northeast. And we do see the lowest percentages across the southern states. When we look at this 39% overall, we do have to realize that it does vary by age. And age is an important consideration, especially looking at risk for severe COVID-19 hospitalization and mortality. Our oldest group of adults, we'll say the 65 years of age and older, who are the ones that we would be most concerned about with these risk factors. I am delighted to report that 74% are fully vaccinated. When we get to younger individuals in a broad range, looking at 18 to 64 years of age, on average, that's 43% who are fully vaccinated. And currently, the youngest group for which there is emergency authorization by the FDA is the 12 to 17 years of age, and those are 9% of them are fully vaccinated. And we do expect to see that increasing, since in the last couple of weeks, the Pfizer vaccine was approved for the 12 to 15-year-old age group. And speaking of the Pfizer vaccine, that is the one, the vaccine by Pfizer, BioNTech. Overall, 52% of the persons who are fully vaccinated, so the majority, have received the Pfizer vaccine. And the Moderna vaccine, we see that 40% of individuals who are fully vaccinated have received it. And then we do want to consider also the one-dose vaccine by Johnson & Johnson, and 8% of the US population has received that particular vaccine. Dr. Polin, why do you think, in your opinion, why is the series completion so important?
Yeah, this is a great question. And there are a lot of misconceptions around this. So when you look at the data, you'll see some people say, well, after one dose, I get about the same level of protection as the J&J vaccine. And so they think, well, let me stop there. What they don't realize, particularly in the face of these new variants, which do tend to have a decreased neutralizing antibody titer against the variants, that by giving two doses, we are both increasing the depth, if you will, and the breadth of that immune response. So we're now moving from 70 to 80% protection against symptomatic disease to upwards of 95% with nearly 100% if you have a healthy underlying immune system, nearly 100% protection against death, severe disease, hospitalization, and as I say, about 95 against symptomatic. So with that second dose, you're getting what is at a population level and an individual level, quite a boost in the level of protection, the height of immunity, which may also play into the duration of immunity. So for all of those reasons, we really do want to see people get 2 doses of any 2-dose regimen. But it raises the issue, what have been the challenges to getting people back for that second dose?
Well, certainly early on, we can remember that, and still to some extent, that most doses have been administered to the public via county-led mass vaccination initiatives, and then more recently by health systems and even by community pharmacies. And this raises the issue of concern for medically underserved areas, in the sense that there might not be the same amount of access depending on where someone lives, if they're in a medical desert or in a rural area. We do know that vaccine enthusiasm among adults appears to have reached a plateau. It seems to have peaked in mid-April. And this does lead us to think a little bit about the issue of diffusion of innovation. Individuals who are very enthusiastic, who were early adopters of receiving their vaccines, if they have all received them already, we are now might be at the point where we're going to have slower growth in vaccine uptake and completion. And so this is where some general issues need to come into play in terms of public messaging, in terms of communicating about the perceived advantage of being vaccinated over not being vaccinated, and of receiving the second dose, just as you have described, and improving the ease of access, and also discussing with individuals the issues of experiencing symptoms from the second dose, that there is a concern for many individuals.
Yeah, I completely agree with you. And so some of, and you've touched on them, but let's talk a little bit more about what these kind of key barriers to vaccine series completion might be.
Certainly. Vaccine hesitancy, we know, is a major issue amongst the population, especially looking at the perception of more severe symptoms after the second dose. And we do find that perceptions of vaccine hesitancy are more common among ethnic minority groups, particularly Black Americans, Hispanics, and American Indian, Alaska Natives. And this really very much goes along with a history of mistrust in government and healthcare that has been prevalent for generations. We also have seen there, in some cases, there has been confusion surrounding a second dose in terms of when to get signed up for it. Some vaccination clinics provide the appointment at the time of the first dose, and others do not. So sometimes there's confusion about that. And also there are issues with having a lack of access to technology. Many times websites are available for registering, but what if someone doesn't have access to the internet or does not have access to a smartphone, text messaging? And then, we have transportation issues in some areas. This goes along with looking at medically underserved areas. And also, we do have fear among undocumented immigrants. And the federal government does have guidelines in place so that there will be no issues in terms of undocumented immigrants being questioned or having to show that their citizenships or resident status.
Very good point. And we need to be sure that that's clear so that people aren't afraid. Well, one of the questions that this begs is, how are we keeping track of this? Is there a system by which the vaccine doses that are being given are registered or counted in some way?
Well, in many states, there are immunization information systems, and a lot of times they're abbreviated as ISIS. And this is used by most commonly pediatrician offices for registering childhood vaccinations, and these are in place for adults as well. So many clinical practices have access to these in all states. And then there also is a vaccine administration management system, which is a temporary mobile system that is used by satellite vaccination clinics and also is used by federal agencies and multi-state healthcare organizations. So these are very useful mechanisms for keeping track of this information, especially if you have people who move from state to state. And also there is a direct data submission process that is in place with the COVID-19 data clearinghouse.
Excellent. So let's just, you and I had kind of talked about a typical case that we would see. Let's take the case of James, who's a custodial worker at a middle school. He got his first dose of Pfizer vaccine, but has not come back for his second dose at this point. What do you think we should do, and how should we think about something like this?
Well, certainly one of the things to be thinking about this is from the perspective of a clinician, and also from the perspective of from an administrative perspective as well. One of the important things would be to talk with James to discuss what is going on. Was he not able to get away from work? Does he have concerns about experiencing symptoms after his second dose that might take him away from being from work, and he is not able to take those days off? So it's a multidimensional issue for which different solutions are possible. One of the things is certainly to discuss with him the issues of getting the vaccine, say on a Friday, if he works Monday through Friday, trying to schedule his vaccine on a Friday so that he has Saturday and Sunday to help him recover, and talk with him about taking acetaminophen and the usual things of trying to get rest and stay hydrated. Another thing also we could look at to see is, I think from an administrative perspective, also along with the clinical perspective, is discussing with him that, it's important to know that just because it was stressed to him that 21 days was important, the CDC does suggest a buffer period of up to 6 weeks, 42 days, for which he could receive his second dose and not have to restart. So he wouldn't be missing out on anything. And then ideally, there would be a mechanism through various, wherever he went, there could be a website or a phone number to get in contact with him, or that he could call to reschedule his second dose. And if possible, if it's needed, any free transportation options for him.
Good. You said something, Lourdes, that I thought was really important, and that is the idea that this is multidimensional. We shouldn't jump to the conclusion that somebody has rejected the second dose or is hesitant. They might be, but there could be other issues involved. And just to be clear, we wouldn't restart this series no matter the time interval from the first to second dose. But obviously, we're trying to encourage people within a reasonable window to get immunized. Other thoughts you have on practical tactics that can be used to get that second dose out?
Oh, certainly. I think as often as many clinics and pharmacies and health systems at great lengths text individuals or email them when it's time for their second dose, I would hope that these same institutions also would text or email them if they've missed their dose and encourage them to come back. And also there are various car services. I don't know if I'm allowed to say their names, but we all know what they are, that they are now providing free rides to their location of choice to receive their vaccine. And also there are mobile units that have been set up in various communities to help out in underserved areas where the vaccines come to you. And I've often been faced with the situation of someone receiving their first dose at a clinic that's no longer going to be active, and they don't know where to go for their second dose. There is a website where they can browse by state and find out a location where they can receive their second dose at a pharmacy. And also they can also browse by vaccine if they have a preference. They can find out the closest location to receive their vaccine.
Wonderful. Well, Dr. Planas, I want to thank you for joining me today. This has been, I think, a very useful and practical conversation. Just a reminder that of the 3 COVID-19 vaccines that are currently available in the US under EUA, 2 of them have a 2-dose schedule, Pfizer and Moderna. Getting that second dose is critical to achieve complete protection against COVID-19. Dr. Planas has provided an overview of the barriers to vaccine completion and some very practical tactics we can use to assist people in returning for that second dose. And even if that second dose is missed at the usual time interval, CDC has suggested a buffer of 6 weeks during which that second dose could be administered. But even past that point, we would still give the second dose and not restart. I hope you found this helpful, and thank you for participating in this activity with us today.